NFPA 1584, Getting Checked Out. There's a new NFPA standard, number 1584, which addresses firefighter rehab. Screening firefighters at the scene is important for a number of reasons. It is now an official standard. It can ease peer pressure to get checked out. It covers some liability issues. And most important, it may save your life. Once again, there will always be exposure to smoke as a firefighter. That just comes with the territory and is sometimes unavoidable. However, what is important is to minimize your smoke exposure. The ultimate irony in the fire service is that we're willing to put our lives at risk to help complete strangers, but we often don't apply the same precautions to safeguard ourselves. Taking these simple minor steps can make major differences in your longevity and overall health.
Lesson 3. Proper use of SCBA is key to minimizing your exposure to the toxic gases in fire smoke. But even when we do things right, the possibility of a smoke exposure exists, which may require treatment. Now that you know about cyanide in fire smoke, and that it's present in just about any structure fire, you can put these two together. Anytime treatment is needed for smoke inhalation, treatment for cyanide poisoning should be considered. There are 3 indicators that someone is in need of treatment for cyanide poisoning. 1. Was the person rescued from a closed space structure fire? If so, is there soot around the nose or mouth? And if there is, does the person have an altered mental status? Are they unconscious or unresponsive, or answer questions inappropriately, or do they appear to be disoriented? If these conditions are true, then treatment for cyanide poisoning is indicated. Cyanide poisoning requires swift medical treatment because the poison acts very quickly. Basic life support treatment begins with removing the victim from the source of exposure to fresh air. Administer 100% oxygen via non-rebreather mask. You may also consider treating the patient as you would any other hazmat exposure by removing the patient's clothing and then performing gross decontamination. Rapid transport to the most appropriate receiving hospital is critical. Advanced life support, performed by paramedics for example, would include aggressively controlling the airway through endotracheal intubation, starting IVs, and treating whatever underlying cause you may find, such as full cardiac arrest or seizures. Your pre-hospital care system may have approved antidotes available for cyanide poisoning. Currently, there are 2 types of antidotes available that have been approved by the FDA for use in the United States. Hydroxycobalamin, or Cyanokit, can be used for confirmed or suspected cyanide poisoning. The cyanide antidote kit, also called the Lilly kit, Pasadena kit, or Taylor kit, use different active ingredients and usually should not be used in the setting of smoke inhalation. Keep in mind that smoke inhalation is a complicated illness and must be taken very seriously. Does your pre-hospital care system have a specific protocol to handle smoke inhalation? Does your engine company, transport ambulance, or other emergency response vehicle carry cyanide antidotes? Does your local hospital carry them? In the end, there's nothing we can do to make you take the necessary precautions to prevent exposure to fire smoke. That's your choice. Through this program, you've learned about the various toxins found in fire smoke, specifically the acute and chronic health hazards posed by hydrogen cyanide. Hopefully, you've also learned about how these toxins slowly debilitate you through repeated exposures. Breathing a little smoke is one thing. Breathing a little smoke every day for 30 years is completely different. The bottom line is that if you properly wear your SCBA and follow your training, you will dramatically improve your health and longevity.